the farther down the road I go teaching, I used to hear reports from therapists and students who took their classes, and they go back and they tell their patients, I learned this wonderful technique. It's called craniosacral therapy. And it's all about the rhythms of the body and how there's the head widens and narrows and the spine lengthens and shortens, and there's this energy flow and there's this release signs, and it makes a person feel better and it makes them more relaxed, and it's just this there's releases and there's energy and there's never mind. Let's just do what we've been doing. And so what I thought would be useful is to create a poster that could be placed right between the patient coming in and the therapist, and they could point to it and give them a good idea of what craniosacral therapy is. And so I defined the poster called craniosacral therapy. What is it? And so I'd like to show that to you. Yeah. So here we go. What is CST? And so essentially what people do is they start right in the middle, and I say, there's different rhythms in the body. There's the heartbeat, and it's 60 to 80 pulses per minute, and there's breath, 15 to 20 cycles per minute, and under that there's a beautiful craniosacral rhythm in which the head opens and closes and the spine lengthens and shortens about 6 to 12 times per minute. And I can take them up right to any one of these. Craniosacral therapy is a manual therapy technique consisting of light touch, listening, and good intention to engage the tissues, evaluate, and encourage the body to change and heal itself. The system's comprised of the cranial bones and the sacrum, that's thus the name craniosacral, and the ventricles and structures that produce and reabsorb and circulate cerebrospinal fluid, that's CSF, fascial membranes, the meninges, that contain and the entire central nervous system, and the CSF itself. The cerebrospinal fluid is a clear fluid filtered from the blood that provides an ocean-like environment for nutrition, cleansing, and protection for the brain and nervous tissue of the spine. And so essentially what we do, and the reason this works, is that the arterial blood flow comes up into the specialized areas called lateral ventricles, and by way of specialized cells called chorioplexes, it filters a clear fluid called cerebrospinal fluid out of the blood, and it surrounds the brain and goes up and down the spine, providing nutrition and protecting the brain from the effects of trauma in the body. It circulates around and then it exits by way of several ways. Other specialized cells called arachnoid villi help exit the CSF from the head, and it returns down to the jugular vein and back to the heart for renutritionalization and circulation. And in recent times it's understood that the CSF is picked up all along the exiting nerve roots in the spinal cord, and it gets picked up into the lymphatics. And so the lymphatics plays an intricate role in the reabsorption of CSF. And so, new patient, with your permission, I'd like to hold you anywhere from your heels to your head and see if we can make this beautiful craniosacral system work better. Because your head isn't like a big coconut. It's got all these beautiful little joints to them. And what we can do is skull bones are interconnected by joints that move like lifting a jigsaw puzzle from the table. We encourage freedom of movement. Using individual bones as handles, we can gently influence the system to function more efficiently, promoting health and healing. Would this be something you'd like to try? And usually the patient would say yes. And then off we go on a craniosacral therapy adventure. and chart a new course in healing and helping a person be independent.